Hello, good morning everybody. Welcome to our Claudia Rose Nutrition channel here on YouTube. How are you today? Welcome. So today we are going to be talking about hormones part 2. So we'll be carrying on from last week. It might be worth watching last week if you haven't already, but I'm just going to give a really super quick recap. And that is, it's when we're looking at hormones, however hormones, whatever sex you are, whatever hormone imbalance there is, we've got to get the basics right first. And the basics, remember, are getting the blood sugar, getting the liver function, getting the gut function, and the omega-3 oil ratio basics in place. So that's what we need to do first. And last week I explained about the different forms of different forms of estrogen, and we took a deep dive into how the body works as a complete orchestra. It's always an orchestra. It's so many things happening in interconnectedness. So today, we're going to be taking this a little bit further, and we're going to be looking at estrogen, we're going to be looking at progesterone, we're going to be looking at the androgens, we'll be talking about menopause, perimenopause, postmenopause, we'll be looking at hormone-related conditions, like, for example, PCOS, endometriosis, and we'll see where we go, see what questions. Good morning. It's so lovely to see so many of you here. So just fire away your questions and I will get to them after I've given you some of the information that's like on the tip of my tongue that I'm like burning to give you, basically. So let's start talking about estrogen, probably the most famous of all the hormones. And whenever I talk about the menopause, I always talk about how our estrogen levels literally fall off a cliff, don't they? They really come crashing down. Whereas with men's testosterone levels, it's so gradual, it's hardly noticeable. But for women, it can be overnight. And when we experience low estrogen levels, I'm going to read out some of the symptoms, and you might recognize them because they're very common during perimenopause or the menopause. So poor memory, which usually corrects after a little while, and that brain fog, depression, wrinkles, the skin, the elasticity and the collagen within the skin really decline as well, because when estrogen drops, so too does collagen. Night sweats, hot flushes, classic menopause, isn't it? Insomnia, leaky bladder, bone loss, of course, because that drop, we talked about it last week, that drop in estrogen stimulates the osteoclasts in the bone to start breaking down more bone. Joint injuries, vaginal dryness. Now, this is where there are always lots of helpful fixes for all of these symptoms, and just put them in the chat if you'd like any extra help. But for example, with vaginal dryness, this is where estrogen pessaries can be helpful, and if you want to do it naturally, the omega-7 sea buckthorn oil capsules taken orally are so helpful for all the mucous membranes, because sometimes women experience, for example, dry mouth, dry sinuses, dry eyes, and these omega-7s are incredibly helpful. Low libido, painful sex. So these are symptoms associated with low estrogen. On the other hand, let's do symptoms now around high estrogen levels, excess estrogen. And you might be thinking, well, hang on, I recognize some of these symptoms, but I'm in the menopause and I obviously don't have excessive estrogen. It's not necessarily to do with excess, it's more about the ratio. So sometimes, because there's a constant juggling act in the body between the estrogen and the progesterone, it might not be that you have very high estrogen, but if your progesterone is very low, it might seem high in terms of the ratio, and that might trigger some symptoms. So you might notice, for example, symptoms of excess estrogen can be bloating and fluid retention, heavy bleeding for people who are having periods, painful periods, mood swings. These are all associated with estrogen. Anxiety, migraines, sore boobs, that breast tenderness is absolutely linked to estrogen levels. And then, of course, estrogen can fuel fibroids and endometriosis. So we'll talk a little bit about endometriosis. Another thing on the list that you might find interesting, you might not know about, is that gallbladder removal really can impact our sex hormones. Because remember how last week we talked so much about liver function and the liver processing the estrogens. The gallbladder is actually involved as well through the bile production, through detoxifying the hormones, and sometimes there can be a slight estrogen imbalance after a gallbladder removal. Another thing to remember in terms of estrogen imbalance is thinking about where is estrogen produced. So estrogen is produced in the body in 3 places. Number 1, the ovaries. That's obviously the most prolific place to produce the estrogen. Number 2 is the adrenal glands, these tiny little glands that sit on top of our kidneys and produce our stress hormones like adrenaline and cortisol. They also produce our progesterone. And then the third place, and we're going to come on to that later when we talk about progesterone, we're going to talk about that. And the third place that the estrogen is produced is in our fat cells. So there is a correlation between being overweight and having higher estrogen levels. So it's sometimes people find by changing their diet, getting on the healthy track, balancing their blood sugar, losing excess weight, that their hormones naturally rebalance, and it can be incredibly helpful. So how do we get our estrogen levels to be more balanced? Well, we've talked about, last week we talked about the tremendous role of cruciferous vegetables, because we talked about it's not just about any, estrogen in general. Estrogen gets broken down into 4 different categories. Watch the video to find out more. But we talked about the importance of cruciferous vegetables. So cauliflower, broccoli, kale, chard, pak choi. There are a few of them, and ideally 2 cups a day. But there are other things we can do as well to help balance our estrogen. And this is where phytoestrogens can come into play. So phytoestrogens are plant-based foods that actually can mimic estrogen in the body. So if you've got an estrogen receptor here, and an estrogen molecule would normally come and attach, but when you have phytoestrogens in the body, they can also attach to the estrogen receptor. And this is absolutely brilliant, because for someone with estrogen dominance, the phytoestrogens can attach, and they exert a much milder effect than an actual estrogen hormone. And for people with really low estrogen, it's again, the phytoestrogen can attach and exert a mild estrogenic effect. So it will help. It will help either way. If you have estrogen dominance, though, however, I personally, I wouldn't be careful of soy products. But if you are low in estrogen, then having the soy isoflavones has been really proven, for example, to help with menopausal symptoms that are associated with low estrogen. So we're talking about soy, but we're talking about fermented soy. So this is miso, tempeh, all of those healthy ones, not the soy yogurts or soy milk, for example. Flaxseed are another phytoestrogen. Evening primrose oil they're all great. Starflower oil, especially if you've got symptoms of sore boobs, very helpful. Alcohol actually increases estrogen in the body, so we want to cut down or reduce the alcohol. I mean, unfortunately, all the latest research in the world of nutrition is showing there is no safe alcohol. Before it always used to be, have a glass of red wine every night, that's absolutely fine. No longer, sadly. It's not about the message is coming through loud and clear. You know, it should be the same advice for pregnant women as it is for the general population, is basically what the advice is now saying. We want to cut the caffeine. Now, you might have started doing that naturally anyway, but we can become more sensitive to the caffeine, and it can interfere with cortisol, with our stress hormone, which may modify estrogen metabolism. Generally be careful about the meat and the dairy products you have. Make sure that they're from, if you can, from organic sources. Be careful about that. Have more fermented foods, so that we want to really keep the gut health healthy. Do you remember about the beta glucuronidase last week? Those scissors that go around snipping the estrogen molecules. So we want to make sure we've got really healthy guts. Consume more prunes. So we all got onto prunes to help with bone density, didn't we? So prunes, there's been some really, really interesting studies around prunes helping support bone density. Now, there's also some interesting research about prunes helping with the estrogen pathways and reducing that hydroxy-16, the dangerous estrogen form. So keep going with those prunes is what I say. Lose weight if needed. And last week we talked about DIM, which is naturally occurring in cruciferous vegetables. So eat your veg, but if you feel like you really do need extra support, then watch last week's video and maybe consider a DIM supplement, DIM. And then there's a whole minefield, and I'd love to hear your opinion, if you've got opinions on this, on the xenoestrogens. So xenoestrogens are again forms that can act in a mimic estrogen in the body, and they're typically from plastics, for example, BPA, cling film, some canned foods. And this is why we should never, ever, ever, ever microwave anything in plastic. Please don't. Please always, if you were going to, heat up something, please, in a microwave, please put it into a Pyrex, something really, really inert. But those plastic molecules, when they start in the microwave, we don't want them transferring onto the food. So let's just take a moment to discuss a condition called endometriosis, which is absolutely associated with estrogen levels. It is estrogen dependent, and what happens is where normally it's a condition in which tissue that normally resides on the inner lining of the uterus can migrate to other parts of the body. Now, it usually stays within the pelvic area, but it can migrate to other places as well. And it causes huge amounts of pain and discomfort. It affects between 5 to 15% of women. And I don't know if you saw the news yesterday, there's a new drug that was previously not allowed, is now being allowed for women with endometriosis. So hopefully that might be of some help to them. But one of the key things we can do is if someone with endometriosis is carrying excess weight, to try and lose that weight, because remember, the fat cells are producing and fueling more estrogen. So we want to help them get to a regular weight, maybe reduce insulin resistance if there is any, like make sure their blood sugar levels are perfectly balanced. Get them on a sort of a lower carbohydrate, make sure they've got plenty of protein and good fats, and to reduce inflammation. So generally an anti-inflammatory diet, which would be, of course, your fish oils, cutting out the sugar, the alcohol, etc., and increasing the fats. So that's estrogen. Right, that is estrogen. Let's talk now about progesterone, if I can find my piece of paper. But low progesterone, the symptoms of low progesterone often tend to be the same symptoms as higher estrogen, because that's normally what happens when one goes high, the other goes lower. So with low progesterone, again, PMS, painful periods, but typically hormonal headaches and migraines and migraines. A lot of women, as they enter menopause, they may have had regular migraines, which then clear during menopause. Other people I've heard, they develop migraines around menopause. Typically with low progesterone as well is fertility issues, because that progesterone is needed to maintain a pregnancy. So what happens is the first half of your cycle, when someone's on a 28-day cycle, for example, the first half is about stimulating the estrogen so that the ovulation can happen around day 14. And then after that, it's about increasing the progesterone to help the lining of the womb fill to maintain that pregnancy. So early miscarriage and infertility is often associated with lower progesterone levels. So to I'm saying floating, fluid retention and bloating, same as excess estrogen, and sore, painful breasts and boobs, and cysts are quite often associated. So with the excess estrogen, you've got the fibroids, the endometriosis. With the excess progesterone, you can sometimes have the cysts, and the cysts, of course, can also be from excessive androgens, which is testosterone. So yeah, sorry, I feel like I'm throwing a lot of information at you. Is this okay? Are you right? So excess estrogen. So this is the testosterone now. And then we'll talk overall about how to. In fact, let's talk now overall how to manage lower progesterone and get this balance going. So there's a technique that I don't know if you've heard of called seed cycling. And the idea is that for the first 2 weeks of your cycle, so remember, day one is the day someone starts their period. That's day one. You want to have the first 2 weeks, you want to have 1 tablespoon of ground linseeds and 1 tablespoon of ground pumpkin seeds on your breakfast. And this will support the estrogen side of things. And then from the second half of your period, of your cycle, from day 14 to 20 to day 1 of your next period, you want to be having 1 tablespoon of ground sunflower seeds, 1 tablespoon of ground sesame seeds, and these support the progesterone. Now, I know this sounds crazy, but I've used this technique in my practice before. Like, for example, I'm thinking of one person. I had a 16-year-old girl who hadn't had a period for a year. And so where do you start with this cycle? So we followed the path of the moon. And it took a couple of months and her periods came back. So it really can make a difference. And it just puts you in control, makes you feel that you're being proactive, that you're doing a lot to help yourself. Remember, with the low progesterone, it can also come about with over exercise. This is a major thing. Like, a lot of female athletes have very low progesterone levels. So just make sure that you're not overtraining. And if you are doing a lot of exercise, make sure that you're properly nourishing your body, that you're getting the fiber. Don't be cutting out all the carbohydrates. Make sure you're getting the quality fiber, and all the other things, the good fats, the protein, etc. And then, so let's now talk about the androgens. So this is often the testosterone. So when we have excess androgens, people might develop facial hair, especially around this part of their hair, acne, greasy skin, thinning hair, skin tags. Blood sugar balance is typically quite unstable. Depression, anxiety, long menstrual cycles. Can often be cysts, and this is where PCOS is often associated, polycystic ovarian syndrome. Now, PCOS affects a shocking 20% of women. And PCOS is when small cysts can form on the ovaries, and then the maturation cycle of the eggs are disturbed. So it really can impact on fertility as well. And is with PCOS, it's actually two main hormones that we're looking into. Number one is the testosterone, the androgens, and number two is insulin. So from a nutritional strategy point of view, we've got to get in there and we've got to balance out the blood sugar levels. And quite often there's low fiber in the diet, and fiber is very, very important with PCOS because it increases something called sex hormone binding globulin. I always write it as SH. Oh, I can't spell it out now. But sex hormone binding globulin. What that does is it goes around and it binds, conjugates and binds the sex hormones, the androgens that the body's trying to clear, and helps excrete them. So often, it is a blood marker that you can measure in a blood test. You can ask your GP for, and that is really, really worth doing. And changing our diets can improve sex hormone binding globulin. So I've had some great results over the years with helping people with PCOS. We even had a couple who've had their diagnosis reversed. So there's a lot we can do, but we go straight in with the blood sugar. And I would even recommend getting, for example, a Lingo, Hello Lingo continuous blood sugar monitor to have a look. So there we go. Anti-inflammatory diet, of course. So, there we are. We've covered hormones. Omega-7, yes, omega-7 was a capsule. We know never to use plastic in the microwave. What are your thoughts about silicone liners in the air fryer? I just hope that it's more stable. I haven't seen any research to the contrary about silicone liners, but we never know. I'd say the silicone liner is going to be better than the Teflon of the actual air fryer containers. So that's personally what I think. But the thing is, if you've got any control on the temperature, it would always be better to do it at a slightly lower temperature from that point of view as well. Yes, exactly. Oh, brilliant. It's someone saying I now use paper liners instead of the silicone as safer. Yeah, the paper would be great, but with the paper, never reuse them because they could be a fire hazard. So always just use and then dispose of. Oh, great question. What's your view on protein powders? I sometimes feel I'm not eating sufficient protein. Now, as we get older, and I'm so sorry for making this assumption because I've got no idea how old anyone is who's asking, but protein becomes even more important. And because we want to be maintaining our lean muscle mass and even building on our lean muscle mass. And actually, as part of this strategy, I'm going to start taking creatine. I've decided creatine, 5 grams a day as a supplement. When I have my collagen every morning, I'm going to start on the creatine because creatine it used to be thought of as, weightlifters, muscle, the bodybuilders were all taking the creatine for their muscle strength. But actually, there's really exciting research about it helping and supporting women, especially menopausal women. So I'm personally going to try it. I will report back. But if you feel like you're not eating enough protein, I mean, we need proper protein with every single meal. And if you feel like you're not, there's nothing wrong with having a quality protein shake. There are some really good ones out there. For example, Sun Warrior is a very ethical brand. You want ones that don't, just not full of all the fillers and all the rubbish. But there are some really good ones out there that, you know, are with cranberry and pea, you know, and all the rest of it. They don't have, you know, my son sometimes buys things like mint chopped chip protein shake. I try to say, well, let's have a look at those ingredients, and it's shocking what's in them all. So yeah, a quality one if you feel like you're not getting enough. But there's, you know, it becomes more and more important as we get older. And the great thing about protein shakes is that they tend to be quite digestible protein, whereas eating a steak, for example, or a big piece of chicken might, for some people, it might be difficult if we don't have enough stomach acid, which is where a little bit of apple cider vinegar just before a meal can be very helpful for helping that. Excellent. Oh, brilliant. The Yucca app is so helpful too. We love the Yucca app, don't we? Absolutely love it. How do you test for low progesterone levels? So you can go to the doctor and ask for ask for a blood test. Now that will be, it's difficult to know. So if you don't know if you're not having periods, you don't know where you are in your cycle, for example, it can be very difficult. If you do know where you are in your cycle, sorry, let me just have a quick sip. If you know where you're at in your cycle, day 21, if you can get that, day 21 is the optimal day to measure your progesterone levels. If you don't know your day of your cycle, then there's something called the Dutch test, which can be very helpful, which is where you submit sample every day for 28 days, and then it will track everything, estrogen, progesterone. It will break down all the forms of estrogen. Very, very helpful. Oh, excellent. Creatine is great for women, I heard, and I take it. Have you noticed any results? Are you combining it with a bit of resistance training? Has it made a difference to your health or your training? Let me know. How much protein? Oh, there's all sorts of formulas, aren't there? 0.75 something grams per kilo of your body weight. I personally, that's not my approach to nutrition, because I don't like weighing, measuring, counting. For me, that takes all the joy out. What I do is, every time I eat, how much protein is there? Have I got a good palm size? And then I personally, like, I know, so like a salmon steak or a tuna steak will probably be around 20 grams of protein. An egg is around 6 grams of protein. So if you've got 2 eggs, that's 12. And you just start making sure that you're getting your grams in, and that you are having proper protein with every meal. Like, don't be thinking, oh, I'll have a veggie soup. Have a veggie soup with a piece of bread, and that's my lunch. That's not quality protein in there. So if I'm having, and it's harder for vegans and vegetarians, it absolutely is. So my secret for soups, obviously I love putting homemade chicken stock in, but if you are vegan or vegetarian, soak some cashews and put those into your soup before blending, and it makes them so lovely and creamy. Anything you can do to enhance your protein is really, really helpful. Oh wow! Oh, brilliant! So yes, I go to the gym, and it feels a lot easier now to increase the resistance. Oh, I'm so pleased. That's really good. I'm following in your footsteps. So yes, we'll report back as well. Yeah, and when we're not having enough protein, our blood sugar goes. Our blood sugar can go a little bit haywire, and then it will impact on our hormones. So, oh, lovely. Chickpeas, nice and creamy in soup. They are. Do you know what I also like doing with chickpeas is toasting them and roasting them with like some paprika or garlic powder, or a little bit of oil. in the oven and making chickpea croutons to go on the top. They're on the crunch sheet to have a bit of crunch factor on your soup, because sometimes we just need a bit of crunch, don't we? So yes. Excellent, excellent. Well, it's lovely to see you all. Thank you so much for tuning in. And next week, my daughter's doing her A levels, and she's had a few offers from different universities. So next week, I'm going to Bournemouth University next Friday. But what I'm planning to do is to upload a video that will come that will be scheduled for 11 a.m. next Friday. So you'll still have a video. It won't be live, but you'll have a video. And then I'll be back the following week. And I want to do it around cognition, nutrition for cognition. So there's again so much to say. So I think if there are any final questions, otherwise it's just been lovely seeing you all. Thank you so much for joining. And I look forward to seeing you in a couple of weeks live. But please just when I post the video, just ask any questions you like underneath, and I'll always reply when I can. Oh, excellent. Oh, it's so nice. Oh, you're on holiday next week. Oh, you live in Bournemouth. Oh, brilliant. Oh, there are a few of you. Oh, amazing. Yeah, we're going to the University of Arts. So hopefully it's going to be great. Okay, everyone. Thank you so much for joining. Have a wonderful, wonderful weekend, and see you soon. Okay, take care, everyone. Bye.